People living near a gravel quarry on the edge of Christchurch are worried their health is at risk because of the toxic dust coming from it. Testing has shown the dust contains dangerous levels of crystalline silica, and the medical officer of health has advised the residents of several nearby households to wear masks. Colin Young paid them a visit.
The quarry on Old West Coast Road was not a problem for residents until the demands of the Christchurch rebuild saw it expand and the number of truck movements increased dramatically. Now their homes and yards are covered in dust, which is at its worst on hot, windy days. Dennis Thompson says tests done by residents and ECAN showed the dust was a long-term health risk because of the presence of crystalline silica.
I was perturbed that this was a reason for why I have a respiratory problem, that when I work outside cutting lawns, cutting hedges, I run out of breath and I feel totally lethargic. And it astonishes me that there is so much of this material inside the house as well.
I mean, there's no escape, is there?
No escape whatsoever.
Things are so bad that Dennis's doctor is recommending he sells up and moves away from the home he's lived in for 30 years.
He's told me something that I didn't want to know, that you've only got 10 years worth of good life ahead of you. Why are you spending it here?
And how does that make you feel?
Well, as a New Zealander, I'm just totally astonished that those who are supposed to look after us are doing absolutely nothing.
The quarry was allowed to expand after the 2011 quake after getting permission from the regional council ECAN. Another resident, Anna Youngman, says it's not acceptable they now have to wear masks when they go outside.
My other neighbour spoke to ECAN and said, well, you supplied the masks. And she received an email back to say, that's not possible. We can't pay for your masks. I mean, ECAN don't want to even get involved now.
Anna Youngman says a promise by ECAN to step up its testing of dust levels is too little, too late.
I've phoned the pollution hotline numerous times and been told to go inside, close the doors and ring the health department. I mean, it's absolutely incredible. It wouldn't happen anywhere else. There's no accountability. If these people can't do their jobs, resign.
An environmental scientist helping the residents pro bono, Dr. Kelvin Duncan, says samples taken around their properties show the level of crystalline silica is up to 20 times higher than the allowable limit.
I was horrified. I mean, the location of the quarry is wrong. It should not be on the edge of a road, a major road, and butting up against residential properties.
Kelvin Duncan says the residents have been exposed to an unacceptable level of risk posed by the crystalline silica.
You do see the dust, of course, but the important stuff is the invisible dust. That's the stuff that does the damage. It's the one that causes cancer. It's the one that causes silicosis. And you can't see that unless you use specialised equipment to take samples.
Nobody from the quarry operator, Winstone, was available to be interviewed. In a statement, it says it's considering improving dust management by changing truck movements, further sealing internal roading, and further enclosing its on-site processing plant. Winstone says it's not in breach of its resource consent. And the regional council, ECAN, says it's upping the number of tests it does at the quarry to 2 to 3 times a day. In Ototahi for Checkpoint, ko Colin Young tēnei.